Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining me again today. Today I am here with a man that I have known for 8 years and never met. So I am so pleased that I finally got him to come on this radio show today. We have such a great show in store for you. Today, Dr. Gary Figuel, who is a board-certified geriatric psychiatrist with Southeastern Geriatric Healthcare on Peachtree Dunwoody Road in Atlanta, is here today to talk with me. And we're going to take you on a journey. So if you or anyone you know or love, or if you're caregiving for someone with dementia, Alzheimer's, any form of dementia, this is a very important show for you. And we're going to talk about some of the signs and symptoms that might have you wondering whether you need to take your loved one or you need to go and get a diagnosis. Hopefully we can help you get an earlier diagnosis. We're going to talk to you about the early stages of Alzheimer's or dementia, and we're going to talk about the mid stages and then the final stages of dementia. And we're going to walk you through some of the hot points so that you are well prepared for the journey ahead of you. Did I miss anything, Dr. Figuel?
That's a good start.
And we're going to do that all in 1 hour. He said to me, we're going to do that in 1 hour. So we'll get to the top level of each one of these stages to help you prepare. And then I promise I'll bring Dr. Figuel back and we can delve into each stage in more depth. Sound good?
That sounds very good.
So first, Dr. Figuel, can you kind of introduce yourself and talk about how you got involved in this and what it is that you're doing now?
Yeah, my name's Dr. Gary Figuel. I'm a board-certified geriatric psychiatrist. I did my residency training at Duke University and then was fortunate enough to go on and become a faculty member at Washington University in St. Louis. And it was there that I was very, very fortunate to spend approximately 5 years in arguably one of the best Alzheimer's training programs in the country at Washington University. And their goal way back in the mid-1980s was already to start tackling a huge problem which still exists today, and that is to train physicians to accurately diagnose Alzheimer's disease in its earliest stages. So I was very, very lucky to spend 5 years at that world-renowned program, and then after that was recruited by Emory to come to Wesley Woods and develop several of their geriatric programs. During this time, I was actively involved in doing research and in various aspects of geriatric care, ranging from Alzheimer's disease to depression. And then I've been in private practice now for approximately the last 15 years, and our practice out of necessity is focused on taking care of people with Alzheimer's disease, the complete spectrum of the illness, being able to utilize my skills that I learned at Washington University, hoping to get as many people as possible diagnosed at an early stage and managing their care throughout their lifespan. We take care of all stages of the illness and try to educate family throughout the whole course of the illness to make the myriad of decisions that are required during the course of the illness as easy and comfortable for the family as possible. So over the past 15, 20 years, we've taken care of, I've been told, approximately 10,000 people with Alzheimer's disease and other forms of dementia. So we've developed a pretty good longitudinal perspective also, and learned a lot along the way, mainly also being educated heavily by my family members and keeping my eyes and my ears open and learning from them about some things that aren't necessarily taught to us in medical school or written in the books. So
you can tell that I am very, very excited to have Dr. Figuel with us today. Is that it? No, I'm only kidding. He is definitely a well-respected and well-educated and experienced board-certified geriatric psychiatrist. So I cannot wait to share his knowledge with you today to help you on your journey. Again, one of the things that you talked about how fortunate you were to go and study and get the education was diagnosing accurately and in the earliest stages someone who has been affected with some form of dementia, whether it be Alzheimer's or any of the other forms. Let's talk a little bit about that, because the sooner you can get diagnosed, the more help can be given throughout these stages.
More help in many areas, right.
So let's talk about getting an accurate diagnosis and why it's so important to get that as early as possible.
Let me just start with the numbers that are really worrisome and that haven't budged much since I've been in the field for a number of years, that unless you've been fortunate enough to train at a place like Washington University, a lot of physicians just have not had the level of training or that provides them the comfort to accurately diagnose Alzheimer's disease in its earliest stages. The numbers are very bothersome. 50% of people that have Alzheimer's disease are never even diagnosed correctly. And secondly, which is just as huge a problem, the vast majority of people, the 50% that do get diagnosed, have already had clinical symptoms that existed for approximately 5 to 10 years. So when we start talking about early diagnosis, there's still much room for improvement in that area.
And so how do you know, Dr. Figuel? Because, we talk about early signs and symptoms like losing keys, but what part of that is normal?
Well, I think the important point is to be able to understand early Alzheimer's disease. And again, it requires training, but also it can be subtle at times, but it also requires a knowledge of what normal aging is. So just let me spend a couple minutes talking about normal aging, because there still is a lot of misinformation or misconceptions from lay people and from trained physicians about what normal aging is. With normal aging, you're not supposed to have noticeable, significant changes in your thinking skills or noticeable, significant changes in your personality or in your behavior. So the key word there is a noticeable change. So as you get older, you're not supposed to start having significant changes in how you think and your thinking skills. Your personality is always how your personality was when you were in your 40s and your 50s. If you're a loving, caring person, you're going to be a loving, caring person when you're 80 and 90. If you were a little ornery, irritable, and mean when you were 40 and 50, you're going to be a little ornery, irritable, and mean when you're 80 and 90. And your behavior is not supposed to change. So another important point is anybody that develops psychiatric symptoms for the first time in late life, whether it's depression, anxiety, agitation, hallucinations, or other symptoms like paranoia, anybody that develops psychiatric symptoms for the first time in late life, always be aware or worried that possibly those symptoms are not a result of a primary psychiatric problem, but the psychiatric symptoms can be the early signs or the harbinger or a warning sign of an undiagnosed dementia or an illness such as Alzheimer's disease. So the key word is change. And with normal aging, you're not supposed to see significant changes. And with Alzheimer's disease, although no illness presents the same way all the time, the vast majority of people, approximately 85% of people with early Alzheimer's disease, present with a relatively isolated deficit in their short-term day-to-day memory. So when you start talking about memory, it's important to, at least initially, tease apart short-term memory from long-term memory. Short-term memory, for lack of a better definition, are remembering events that have occurred in the past several hours to the past several weeks, whereas long-term memory is things that could have happened 5, 10, 15, 20 years ago. In the earliest stages of Alzheimer's disease, what you'll start seeing in approximately 85% of patients is a relatively isolated deficit in short-term day-to-day memory. And what that means, your memory for things a long time ago, things that happened 5, 10, 15 years ago, can be perfectly normal. So if your doctor just asks you, how's your memory doing? Oftentimes family members will, without differentiating between short-term and long-term memory, oftentimes family members will say, Mom's memory's great. Just the other day we were talking about her birthday party 10, 15 years ago, and she remembered everything. So unless you preface the difference between and predefine the difference between short-term memory and long-term memory initially and focus in on the short-term memory, you're already going to start losing some diagnoses. And so isolated short-term memory problems. And then what we'll find, the complaints I get the most from patients who are aging, who are worried about getting Alzheimer's disease, two questions I get asked hundreds of times. A patient will come into my office and say, Dr. Figuel, last Tuesday at 8:30 at night, I went upstairs and I couldn't remember what I went upstairs for. And my response to them is, I'll bet 5 minutes later you remembered exactly what you forgot and you found it. And 99.9% of the time they'll say yes. But also in the process of telling me their worries, they remembered when it happened. It was last Tuesday at 8:30 and they couldn't remember it. So that's one key point. And two two adjectives which are helpful in beginning to understand the difference between normal aging and early Alzheimer's disease. I'll use the word episodic memory changes versus consistent memory changes. So with normal aging, you'll see some episodic changes, which means you might forget something once in a while on a Monday or a Friday, but it usually comes back to you a few minutes later. Whereas with Alzheimer's disease, once the memory changes start, it's more consistent, meaning that if you're a good detective and your eyes are open, you're going to see subtle changes that are there day to day. Again, initially, it's not going to be a complete loss of your memory. It's going to be very subtle, but there's going to be consistent day-to-day changes. And the other adjective I want you to remember and helping to differentiate normal aging from early Alzheimer's, we talked about episodic versus consistent. The other one is progressive versus non-progressive. Someone that has normal aging and is worried about having some memory changes, it's not usually a progression over time of worsening memory problems. So if you came into me in January and said, Doc, I'm a little worried, I'm having trouble remembering things, and I tested you and thought you were okay, and then 6 months later you came back, I wouldn't, if you were in the normal aging category, there wouldn't have been a progression or worsening of your symptoms. Whereas somebody in the early stages of Alzheimer's disease, if there were some subtle changes at that first appointment, and then I didn't treat you and try to start to slow down the progression of the illness, and then saw you 6 months later, there would be a worsening or progression of your short-term memory problems. So that, in a nutshell, is some of the ways we can differentiate normal aging from early Alzheimer's disease.
I love that you were talking about, because that's been something I've had a hard time putting a finger on. You know, my mother loses her keys. We all live busy lives. Sometimes we get forgetful, but it doesn't necessarily mean that you're in early stages of Alzheimer. But something you said hit home. You may remember. You went upstairs. I do that. I'm in my mid-40s. I'm thinking, oh my God, could I have early Alzheimer's? I go upstairs. What the heck did I come up here for? And then later I say, oh yeah, I was looking for the batteries in the second drawer. And I remember and I go back up. Phew, you just made me feel a whole lot better. Because that was just episodic. It's not consistent. It's not something I'm always doing, and then I remember later.
And it's not progressing.
So that's a wonderful way to show the differences. So that being said, if we have a caregiver or a loved one recognizing that this is happening a lot more often, they go upstairs and they walk in circles and forget what they're there for, they never really remember, and it's happening more and more often. You need to bring your loved one to a doctor and see if there's a diagnosis.
If I can just digress a little bit, and just in a nutshell, just sort of try to summarize what the training at Washington University was, which again specialized in early diagnosis. What they had us do and how they trained us. Alzheimer's disease is still a clinical diagnosis. So what does that mean? Even at this early stage of Alzheimer's disease, there's no blood test that you can do that can diagnose Alzheimer's disease. You can't diagnose it from an MRI scan. You can't diagnose it from a CAT scan. So the diagnosis is still a clinical diagnosis, which means we collect information initially from the family members and then test the patient with information that we've gathered from the family members. Again, in the early stages of the illness, specifically focusing on events that have occurred in the patient's life within the past several weeks, focusing on short-term memory. So what we did at WashU, we and what we do in our practice now is, and what we've done over the past 20 years is, we'll bring the family members in initially and oftentimes tell them in advance, collect relatively important information that's occurred in the patient's life within the past several weeks. So the holidays are always an easy time for me because there's so much going on that's relatively fun and important. Questions we'll ask the patient. Who came in over the holidays? Did they fly in? Did they drive in? Who stayed at your house? Or if the patient went somewhere, did you drive? Did you take an airline? Who took you to the airport? How many days were you gone? Did you stay at a hotel? Things like that. And you can it can become fun. You can make it creative. If they watch the news all day, right now would be fair questions to ask about the airplane that's missing out of Malaysia, and you can just ask questions. What's been in the news? But assuming that they watch the news, so you need to get that information correctly from the family members, so you're not just randomly asking questions that aren't pertinent. But if mom or dad is a news watcher, then it's fair game asking about recent events that have occurred in Ukraine, or the airplane is missing. If Dad's a golf fan and the Masters happened the previous weekend, you can add, and Dad was glued to the TV set all weekend, it's fair game. Who won the Masters? If Dad's a Georgia Bulldog fan, things such as that. And with Mom, similar types of interests that she might have had. If Mom is playing bridge, when's the last time she played bridge? Who picked her up? When's the last time you went out to lunch with your daughter? So things that are relatively important in their lives. And the important point here, and again, this is the subtlety of the early diagnosis of Alzheimer's disease. Again, with normal aging, you don't see a consistent loss of your short-term day-to-day memory. So the types of questions that I've just given you examples of, I think it's fair to assume if we're not having any significant memory problems, that most of us would remember answers to those types of relatively simple questions. And what I started observing at WashU, and what I've further learned and further appreciate over the last 20 years, that when you sit down with someone with early Alzheimer's disease, so we've gathered this information from the family members, then we bring the patient in the room and we ask them these similar questions. People with early Alzheimer's disease answer approximately 50% of those types of questions correctly. And so if the spouse is still alive and the spouse is still healthy, that 50% doesn't cause a lot of problems. They're still able, their social skills are still intact. They're still able to drive. Mom's still cooking without making mistakes. Whatever her lifestyle has not been significantly affected socially at that point in time when she's having some very, very subtle, slight decline in her short-term day-to-day memory. And that, in a nutshell, is the earliest stages of Alzheimer's disease. Your social skills are still intact. Your long-term memory is still intact. Your interest in your hobbies is still intact. And your love, whatever your love of life was, whatever hobbies or interests or social skills you had, are all still going to be intact at that early stage of the illness.
But if you are seeing some signs, you want to get that diagnosis as early as possible. And because there's not a lot of changes in behavior and personality and socialization yet, that does not mean, oh, we don't have to address this right now. It is so very important to get a diagnosis as early as possible. And remember, Dr. Figuel, at the beginning of this show, he mentioned that 50% of people don't ever get correctly diagnosed. And of the other 50, it's usually 5 or 10 years after the symptoms started. And I'm here today with Dr. Figuel because we want you to go, if you have any questions or concerns about a loved one and whether or not they're in early Alzheimer's or some form of dementia phase, go and get them tested. Get the clinical opinion of a doctor like Dr. Figuel. Because once we have that diagnosis, there's some things that we can do to treat early to hold that disease at bay. Correct, Dr. Figuel?
Yes.
So if you're in the phase right now where you're just not so sure, but you're noticing some changes, it does not hurt to go to the doctor and just find out, like Dr. Figuel said, you might come in and he might say, no, I don't think so. But now you have a baseline.
You know, one other important point, again, which again is one of the reasons why Alzheimer's disease isn't getting diagnosed at this point, is that even in the very, very earliest stages of the illness, the vast majority of patients are not aware that they're beginning to have that subtle decline in their short-term day-to-day memory. It's the folks that come to me that are worried about their memory that are 99% of the time are fine, and I call them the worried well. But that's, again, another one of the big barriers. I guess you could say it's a blessing. You're not aware that you're starting to have trouble with your memory, but it's also a barrier for early diagnosis. So they're not accurately relaying information to the physicians that they are losing.
But their caregiver is...
Well, this hopefully with shows like this, we're beginning to train the caregivers so they can, and family practitioners, to begin to differentiate the difference between early diagnosis and normal aging. Because again, once again, repeating, there is no test out there, paper and pencil test or brain scan that the doctors can give you that will allow an accurate diagnosis for Alzheimer's disease at this early stage. So it requires a fair amount of training on the doctor's part. And just to give you an example, just to digress a bit, but why it's not happening. You know, when I went to this outstanding clinic at WashU, they had this wonderful, the program had already been in place for 10 to 15 years. So I can take no credit at all for the knowledge I obtained from them. It was just a blessing to be there. But they had accumulated this unbelievably beautiful, informative archive of videotaped interviews of families and patients that had donated their lives and their brains to science and autopsy. And they had this wonderful archive of people that had been interviewed and had subsequently stayed in the program for 10 to 15 years and had died, and their diagnoses were 99% confirmed at autopsy. So you knew exactly which of these patients were early stages of Alzheimer's versus normal aging. And before you could even participate in this program at WashU, they locked me up in a room for literally around 2 months, and I remember having to watch close to 30 to 40 one-hour taped interviews, and then I had to be in accordance with the diagnosis, or I had to be correctly diagnosing these patients who had autopsy-confirmed diagnoses. I had to be 95% in agreement with the diagnosis before they would even let me participate in the program. That being said, that's the amount of training that's possibly required on a national level for physicians to be able to diagnose Alzheimer's disease. So that's another reason why it's not happening. That being said, at WashU, the clinicians, after that degree of training, were 93% accurate in being able to diagnose Alzheimer's disease accurately at that early stage. I mean, the hunt right now, the Holy Grail is looking for an easier way to diagnose Alzheimer's disease, whether through a blood test or some type of brain imaging study. But that's unfortunately not going to be here for the next few years. So we're still, at least for the foreseeable future, going to be relying upon clinicians who have been trained in early diagnosis. And one other thing too, which we could talk about now or later, and there's I would say a debate out there, which I'm not sure I'm in the majority on this one, is whether you tell patients, even at this early stage, whether they have Alzheimer's disease or not. A lot of the books I read say you're supposed to tell the patient, but what I do normally is I meet with the family first and tell them, I usually don't see a lot of benefit from telling somebody they have Alzheimer's disease because in my experience, more often than not, it scares them. Even though I reassure them and I tell them that we're going to be able to really maintain a high quality of life. But there is a debate out there about whether you're supposed to tell a patient they have Alzheimer's disease or not, and that's something we can talk about at a later time. Yeah, we'll have to talk more about that too.
But what I want to do, because we never have enough time, and we're definitely going to have you back, because you can talk. But let's give some folks a resource. What's a great website to go to if they're concerned about a loved one right now or themselves?
Well, the Alzheimer's Association.com is still the gold standard. They know all the physicians in town that are trained. I would certainly consider Emory University Department of Neurology and or Psychiatry because they have a very good treasure chest of physicians there that are trained in early diagnosis, along with a lot of their research right now is focusing on the earliest ways we can catch people who are beginning to develop symptoms. In fact, we're talking about now clinical diagnosis. The research, the academic research, is they're looking at brain changes that might be occurring 20 to 30 years even before this earliest clinical stage.
Yeah, I read something about that recently.
Right. Two other books that I love are The 36-Hour Day and Learning to Speak Alzheimer's Disease by Joanne Kost. That's a little bit, the 36 Hours Day is more of an overview of Alzheimer's disease in general, and Learning to Speak Alzheimer's Disease is more of a book filled with clinical pearls for caregivers, for people that are already past the early stages of Alzheimer's disease that are developing a lot of the other problems that can develop in the middle stages of the illness.
Okay. We have to take a quick break, but we'll be right back and we'll talk about the early, mid, and late stages of dementia diagnosis when we return. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for staying with me. Again, I'm Jean Pete, and I'm here with Dr. Gary Figuel, who I want to give you his information because he's got such great knowledge and experience and expertise in diagnosing and treating patients and helping their families through the journey of any kind of dementia like Alzheimer's. He is at a board-certified geriatric psychiatrist at Southeastern Geriatric Healthcare, and that's located at 5505 Peachtree Dunwoody Road in Suite 230 in Atlanta. But you can contact Dr. Figel's office at 404-497-1830 if you have any concerns that you might be heading down this road of Alzheimer's, either with you or a loved one. Please call him today, because it is so important to get that early diagnosis. And we talked in the first part of the show about how hard it is to get an accurate diagnosis, and how most diagnoses come 5 or 10 years after symptoms start. We don't want you to wait that 5 or 10 years. We want you to go in, however scary it is, and get that diagnosis so that we can get you treated, because the treatments in the early stages of diagnosis can hold the disease at bay and keep you with a much higher quality of life for a much longer period of time. So Dr. Figuel, let's talk about early stage dementia and what some of those treatments are and how it can affect the life of someone if they get that early diagnosis.
There is, again, some controversy about the effectiveness of the medications in the early stages of the illness, but I just want to give you my own personal experience, which, again, we've taken care of approximately 10,000 patients with Alzheimer's disease longitudinally over the last 15 years. 15 years ago, prior to our growing understanding of potential risk factors for Alzheimer's disease and lifestyle risk factors and medical risk factors for Alzheimer's disease, we relied solely upon monotherapy with a single medication such as Aricept. And at that point in time, it was not uncommon for us to be referring patients into hospice who were passing away from Alzheimer's disease. At that stage, people would pass away from Alzheimer's disease because they no longer could walk, or they were having trouble swallowing and developing skin breakdown and infections and dying from things such as that, or aspiration pneumonia. Fast forward 15 years later now, we've learned a lot about the growing list of risk factors for Alzheimer's disease and ways that we can potentially modify risk factors and lifestyle changes, along with early initiation of combination therapy medications, such as combinations of Aricept or Exelon, along with Namenda from the earliest stages. I just want to repeat, there can be some confusion and debate about that because there haven't been a lot of studies looking at the use of Namenda from the earliest stages of the illness. All I can tell you is, in our experience, we have seen a very pleasant, positive slowing of the progression of the illness over the past 15 years. Is it all attributable to the medications? No. As I said, a lot of it also has to do with our growing appreciation of the risk factors for Alzheimer's disease. We still don't know what the cause of Alzheimer's disease is, but the list of risk factors and our understanding is growing. And one of the more particularly interesting group of risk factors are cardiovascular risk factors. So anything that potentially is a risk factor for heart disease is also potentially a risk factor for Alzheimer's disease. So we're more aggressively intervening in patients with early Alzheimer's disease to make sure they're not developing high blood pressure, making sure their cholesterols are reasonably controlled, making sure their diabetes is reasonably controlled. All of those potentially, we believe, and hopefully the research will support over the upcoming years, will possibly delay the onset of the illness or possibly slow the progression of the illness. Also, exercise. The literature on exercise providing a healthy brain is very impressive. And importantly, if you're not a big exercise fan, you don't have to kill yourself. The more recent work is suggesting that just a very casual 20-minute stroll 5 or 6 times a week can be very, very healthy for your brain. So I can't tell you how much we try our best to emphasize and get people walking every day. And then diet is also very, very important.
Everything comes down to eating well and exercising. And every show I do, I got to get out and move my body and eat well.
There's been around 4 or 5 papers published on the Mediterranean diet, which is big on extra virgin olive oil and tuna, salmon, and sea bass and/or trout a couple times a week. Those are biggies too. And then there's other things we're doing also to minimize risk factors, and these are a little bit more out of the mainstream, but certainly not dangerous. Some people with elevated homocysteine levels may benefit from using higher doses of certain vitamin Bs like vitamin B6, B12, and folic acid. Also, although the data still is out from a scientific standpoint, whether some type of anti-inflammatories, and by the way, exercise is an anti-inflammatory. And why is that important? Because in the early stages of Alzheimer's disease, as your brain is being affected from the illness, inflammation is occurring in your brain before the cells die. So much research is being dedicated to looking at anti-inflammatory. So exercise is an anti-inflammatory. The type of healthy fish oils you see in salmon and tuna are also anti-inflammatories. And research into antioxidants such as vitamin C and vitamin E is something we can talk about down the road too. But the point is we've learned a lot about things that we can do to potentially minimize Alzheimer's disease. The progression of Alzheimer's disease. And one last thing, which I know time is valuable here, but people with Alzheimer's disease, even at the earliest stages, are not able to withstand any type of medical problems. And many people with Alzheimer's disease even that suffer from a minor medical problem, such as a urinary tract infection or even a minor fall, can show significant decline in their cognitive skills or their functional skills. And certain things are preventable to a degree. And in our practice, we've become very attuned to the needs of the patient and identifying people at risk for falls, at risk for dehydration, at risk for urinary tract infections, people that have a history of recurrent respiratory infections. And if you identify those problems early and you treat them a little bit earlier on, a little bit more aggressively than in people with Alzheimer's disease, that also can have a significant effect upon the slowing of the illness in our experience.
I see it all the time. I mean, I've been in healthcare for a long time, but that fall, my grandmother had chronic heart failure. She didn't have Alzheimer's, but every single time she was in a hospital for something, an upper respiratory infection or whatever, I used to say, I get like 80% of my grandmother back when she comes out of the hospital. We could never get her back to that 100% mark. So, folks, what I want you to hear is early diagnosis can mean early prevention of what we can expect to happen now that we know you have this disease. And we can educate you and your loved one about the roadblocks that might be in front of you so you can avoid them and stay healthier longer. That mixed with the medicine, which is the educated approach to early Alzheimer's, plus the new focus on, we're always focusing, when you go to the doctor, they're always going to check your blood pressure and your heart and cardio and all of that, but it's a renewed focus because Dr. Figuel is assuming a tie there and he can keep you healthier longer. And that's what we can offer in this day and age with an Alzheimer's diagnosis. And you want that early stage to last as long as possible because you're still functioning and social and not a whole lot has changed. So don't be afraid of getting a diagnosis. Face it, get on the right therapies, get moving your body, and start eating healthier, and then you're under the care of a doctor. You go to Dr. Figuel. He's going to hold you accountable so that we can keep you living your best life possible for as long as possible. Now, my question to you, Dr. Figuel, since we know that if they get an early diagnosis and we can get them on these treatments, which are really very non-aggressive.
Yes. The medicines are very safe and have very few side effects.
And just walking 20 minutes a day and changing little things in your diet and helping you live. Once we know that, if we prolong the early stages years by years, can we deduct that the middle and end stages are then shorter, or are they longer?
Well, in our experience, as I told you before, we accumulated our knowledge of this comprehensive approach to treating Alzheimer's disease. It was not uncommon to see people dying from Alzheimer's disease. Now, fast forward, 15 years later, where we have a much more comprehensive medical approach and understanding all the potential risk factors of aggravating the illness or accelerating the illness. In our practice, the vast majority of patients no longer are dying from Alzheimer's disease. They're dying from natural causes. And implied in that also is that you have a much higher quality of life. And the one important thing which I want to repeat here numerous times is
because you're living longer.
but quality of life too. We just again, Alzheimer's disease is such a scary word, but our goal is, even in the latest stages of Alzheimer's disease, and our goal is that you never get to that later stages, but even in the latest stages of the illness, we want you to have a smile on your face and a twinkle in your eye, and when your family members walk in the room, that you're able to love each other and hug and kiss and enjoy each other's company. So even though it is a scary illness, the goal is to maintain the highest quality of life, and it's obtainable as long as you get in the proper hands and receive the proper care, and they understand that it's possible to maintain that degree of quality of life even in the later stages of the illness.
So there's so much that we still don't know, but the fact remains we are seeing changes in the ability to prolong early stage Alzheimer's, but we need your help. You can't fear a diagnosis. You have to be more aware of short-term memory changes and get to the doctor and get a diagnosis as soon as possible. And it helps you too because there's other things that need to be put in place legally, financially, and the earlier you get it, the better off you're going to be to prepare for the future and the journey ahead. So now let's take folks to middle stage diagnosis. What happens in middle stage dementia patients?
And people, one of the questions I get asked the most, which I always digress from, and they'll ask, what stage of the illness is my mom at? Because a number of years ago they came up with a number of what I consider relatively arbitrary stages, and I think were developed before we've come up with more therapeutic interventions for the illness. So I'm not, at least in our practice, those stages don't apply necessarily all the time. But whenever you're evaluating somebody with Alzheimer's disease, and we're talking about the progression of the illness, there's three areas you have to look at to really overall assess the patient's capacity and their quality of life. Number one is their cognitive skills. And then number two, are they in that group of patients, the 30 to 50% that start developing behavioral problems, ranging from depression to agitation to insomnias to hallucinations, and that oftentimes becomes more of a significant problem for the caregivers than the initial attack with the memory loss. So when that starts creeping in, making sure we get the proper care for the behavioral problems is every bit as important, if not even more important at that point than the cognitive problems. Then the third area which needs to be evaluated, and everybody we're taking care of, are their functional skills or their activities of daily living. So so whenever you go in and you get evaluated, you want a comprehensive evaluation. Remember your ABCs. A's are activities of daily living, B's are any behavioral problems developing, and then C are cognitive problems. So just getting back to the cognitive issues, and again, everybody is a little bit different, but again, we talked about at the very, very earliest stages of Alzheimer's disease, you'll see an isolated defect in short-term day-to-day memory. So let's just assume that the patient's not being treated, and we would see sort of what would be the typical progression of cognitive problems that might occur over a 5 to 10 year time frame. Initially, you'll see the short-term memory problems pretty much isolated by themselves. They'll still be pretty much on key with the day of the week, the months, and the years. But when you get into, say, 2 to 3 to 4 years into it, and again, everybody's a little bit different. The long-term memory's still pretty darn good, but if you're a real good detective, you'll notice that mom or dad, after that initial deficit in short-term memory, you'll notice that many patients start becoming quieter and not initiating conversation as much, not using as much spontaneous speech. And in fact, if you ask them some questions, you'll notice mom or dad are answering with shorter responses, 3 or 4 or 5 word answers versus 3 or 4 or 5 sentences or several paragraphs. So their verbal skills or their language skills start becoming impaired, and they're no longer able to talk as freely. And if at times you'll notice they're fumbling for a word and not able to get a word out as easily. And after we're 2 to 3 or 4 years in, might start having a little bit of problems remembering the day of the week or the date and things such as that. You progress a few more years into the illness, maybe you're out 5 or 6 years, you'll start seeing some difficulty with visual spatial skills, where and the way we usually test for that very characteristically, we'll ask the patient to draw a clock. And what I'll see over and over again in people with sort of the late, early, or early middle stages of Alzheimer's disease, they'll start, when you ask them to, I'll draw a circle and ask them to put all the numbers in on the face of the clock, they'll squish all of the 12 numerals into one half of the face of the clock, and I'll call that the squish. But so in sort of the middle stages of the illness, if you're doing cognitive testing in the office, you'll see deficits in short-term memory, maybe having a little bit of difficulty on the day of the week or the date, maybe a little bit of trouble on whether it's March or April. If you start testing them for language skills, we'll commonly say name as many animals as you can in 1 minute. You'll see for a normal person, they'll get approximately 15 animals in 1 minute, and someone in the middle stages of Alzheimer's disease, and again, this person's already starting to get noticeably quieter and not initiating as much conversation, they'll oftentimes only answer maybe 5, 6, 7, or 8 animals as opposed to the normal 15. And if you ask them to do the clock drawing, you'll see trouble with getting the numbers on the clock correctly, and they'll squish all the numbers into one half of the side of the clock. As the disease continues to progress, you just continue to see more and more impairment of all of the above, becoming not remembering what year it is, then not having more of a difficulty differentiating now is it March versus December. The language skills will continue to deteriorate. Now you'll start to see some holes in the long-term memory will start to appear at those later stages. And one other subset of patients, which I've only really grown to appreciate in the past 5 years or so, besides all these other cognitive problems that we've been talking about, there's a significant subgroup of patients with Alzheimer's disease, approximately 30 to 40%, in addition to the memory problems and the language problems and the visual spatial problems. 30 to 40% of patients start developing problems with attention and concentration. And very specifically, I'll just ask them to do very simple tasks like counting backwards from 10 to 1, or if they can't do that, even asking them to count backwards from 10 to 1, or if they're able to do count backwards successfully from 20 to 1, I'll ask them to do the months in reverse. And 30 to 40% of patients with Alzheimer's disease can't do one of these three concentration tasks. And why is that important? Because it's a whole new set of problems that you run into with these folks. Just about everything we do in life is a task of concentration, ranging from eating to focusing on watching television, reading a newspaper, or any of our hobbies. So oftentimes patients with the concentration problems get brought to me because the family thinks mom or dad's depressed. But what it really is, when you lose that ability to concentrate, you no longer are capable of multitasking and initiating in activities. So you tend to stay in one place and wait for someone to help you initiate activities. So they can possibly be diagnosed as depressed, or families will think they're depressed. But very, very importantly, too, the folks with the concentration problems are very, very prone towards dehydration and not drinking enough and not eating enough, particularly if they're living by themselves. So weight loss, which oftentimes can be thought of as a symptom of depression, but in reality it's due to the cognitive problems. And again, we talked about earlier the importance of medical problems, accelerating Alzheimer's disease. So this is one really important time point where you can intervene and educate families and doctors. If you're noticing those deficits in attention and concentration, those folks are at risk for dehydration, which can lead to urinary tract infections, which can lead to low blood pressures, which can lead to falls, all of which can be prevented to some degree by early identification of those folks.
And which, if we're not educating and looking out for it, will speed the progression of the disease into late stages very quickly. So again, another reason why it's very important to get an early diagnosis and stay with your treatments with your physician.
So we talked about the cognitive progression. If I got a couple minutes, and we're talking about the ABCs. So we just briefly went through the cognitive progression of Alzheimer's untreated. I just want to reiterate, with the medications, we hope that we don't get to those later stages of the illness. But when you get to the middle stages, around 30 to 50% of patients start developing behavioral problems. We've talked about depression, agitation, paranoia. Very, very important, because at that point the caregivers are already becoming weak. They're stressed out.
This is the toughest stage for caregivers.
Right. And when the behavioral problems develop, you definitely want to go to a specialist that helps you understand what the optimum treatments are for these behavioral problems because it's relatively complicated. Medications are helpful at times, but medications can be dangerous at times. And understanding the balance between which of these symptoms are being caused by the environment and how well you can train the caregivers or the staff, whether it's appropriate to start thinking about assisted livings at this point in time, are all very, very critical decisions that need to be made with some of these folks. I mean, our goal is to keep everybody at home as long as possible, but the bottom line is many patients who develop these behavioral problems, oftentimes the symptoms are worse at home than they are in a really good assisted living. So the behavioral problems are a huge problem for caregivers. But again, on the optimistic side, if they can be controlled and treated properly if you get to the right caregivers.
And I just want to digress for 1 minute because I feel so strongly about this, Dr. Figuel. The day you get a diagnosis for a dementia, whether it's Alzheimer's or Lewy bodies or whatever other form of dementia there is, and there's lots of different forms, but as soon as you get some form of a dementia diagnosis, that day you need to call and see a financial planner and get legal consult.
Yes.
Because this is why it's so important to get detection as early as possible. You have to have a future plan. And I've seen it so many times where one caregiver is responsible for 90% of the time taking care of the loved one with dementia. And maybe decisions are made. I'll sell this house, I'll buy this house, I'll move in, I'll use her money to pay the rent, and I'll take care of her. And it's a point where you have to sometimes talk about assisted living, and then you can't afford it, and then you got to sell the house you live in order for mom to go here. There's so many examples of why we've got to get your early diagnosis, and you've got to go and get planful, legally, financially, lifestyle-wise, so that you are more able to take care of your loved one through the entire journey.
Yeah, you definitely want to be educated about the healthcare policies that will allow you to go to assisted living if that's what's best for
And sometimes it is because it's
right.
a safety issue, and then it becomes the health of the caregiver as well. You can't do it alone all the time.
There's multiple factors. It's the caregiver's health. It's the safety of the patient, and even the quality of life of the patient. Because again, even though it's totally counterintuitive, there's a group of people that literally have a higher quality of life living in a good assisted living facility than they do at home.
Right, and because there's more than one person.
Right.
They get to share
social stimulation, the structure.
and there's other people that they get to talk to.
Right.
And I can't stress it enough. Most people feel so guilty because they had to place so-and-so or so-and-so. But when it becomes an issue of safety for your loved one, or it becomes an issue of health for you, you may need to make those decisions. And so you have to start planning. You have to put a 10-year future plan in place. We didn't get a lot of time to talk about the end stages of Alzheimer's, but I think this middle stage is the most difficult stage for caregivers. And because you start to see the ABCs, the changes in the cognitive more pronounced, the changes in the behavior. And if we get you early, you've planned for this stage, and you're ready if you have to go to the next stage as well.
And a significant number of the people at that stage that we're up to right now, still their functional skills have declined minimally. They're not requiring that much assistance. There's always going to be exceptions depending on your medical problems and such, but the caregivers are more needed there for safety purposes than for literally helping the patient. Bathing and incontinence hasn't dramatically stepped in yet at this point. Falls haven't become a huge problem yet, but those things can happen down the road if the illness does progress.
Okay, and we don't have a lot of time to talk about end-stage Alzheimer's, but as we've taken you on this journey, you can imagine that the final stages are where there's not a lot of physical activity being able to be had, sometimes bedbound. There's been a lot of infections or UTIs. The drugs are not working anymore to hold the disease at bay. It may be time to bring in home health or hospice, depending on what part of the end stage you're in, and there's more resources available to you. But what I want to stress to you all is if you are going through this, no matter what stage you're in, please reach out to get help from a physician with the expertise like Dr. Figuel, or I'm a little subjective, but I would call Dr. Figuel at 404-497-1830. And again, he's located at 5505 Peachtree Dunwoody Road, Suite 230 in Atlanta. That's 404-497-1830. Dr. Figuel, thank you so much for coming. You're going to have to come back because we could do a lot of stuff. Heck, you could do the whole show. I wouldn't even have to be here. I'm Jean Pete. I hope you enjoyed the show today. Have a wonderful week. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.